Good afternoon, everyone. We are going to go ahead and get started here. This is Marcelo with Phase Group, and just a little bit about us. We are your full spectrum broker. We provide everything from benefits, wellness, and HR solutions to compliance and payroll. Today, we're going to be going over how to save time and money with telemedicine, and we have 1-800-MD here to help us out with that. They're one of our partners and definitely telemedicine experts. We have Carol on the line, and she's going to be providing a lot of really valuable information as well as some new technology. Just a couple important reminders as we get started here. If everyone could please put their phones on mute as they enter the room, that'll help get rid of any unwanted feedback in the background. If you do have any questions, please go ahead and type them into the chat box. We'll be answering all of those questions at the end of the presentation. Also, we will be sending out a follow-up email just to recap everything that was discussed here today, as well as a recording of the webinar. So Carol, I'm going to go ahead and turn it over to you now.
I appreciate it, Marcelo, and thank you for the opportunity to talk a little bit about telemedicine and 1-800-MD with your clients and prospects, and I appreciate everybody's time today. So again, my name is Carol Tholen, and I'll just go through kind of a brief introduction to 1-800-MD, talk a little bit about where we fit in the telemedicine marketplace, some of the impactful benefits that telemedicine has, not only to the members that use it, but also to the employers that provide it as a benefit. And then question and answer. I look forward to hearing everybody's comments. So 1-800-MD, we're one of the nation's oldest and largest telemedicine companies in the marketplace. We're one of the top 5. We are a distant 5th, but we believe that's one of our differentiators and one of our strong points. We are privately held. Our founder and CEO, Andy Jacobson, started us in 2004. We started out, he and his family happened to be on vacation in Las Vegas. His wife became ill, and he did not want to go to an urgent care center or an emergency room during their family vacation, and felt like there could be an easy solution to what was a sinus infection. So she ended up calling the hotel concierge and asked if there was an alternative care provider or a way she could get treatment. And they had a concierge physician on staff at the resort. That's how this started. A light bulb went off for Andy, and he thought not only was this convenient, but it was relatively inexpensive compared to going to an emergency room or an urgent care center. So that's how we started. When the ACA passed in 2009, we became solely a telemedicine provider. We continue to be privately held. Andy is our sole owner and runs our day-to-day operations. Therefore, our client success is our real focus. It's not investor concerns or profitability or venture cap VC money or anything like that. We have been profitable since 2011. So we have our own proprietary of over 1,700 physicians across all 50 states. It is our proprietary network of physicians. We do not subcontract that out to another network of physicians. We have a medical director that recruits and trains all of our providers, and then our provider relations department in our Charlotte offices, that's our corporate offices, manages those physicians. Consultations are available 24/7, 365 via phone, video, and email. Phone is the primary method of choice for most members in the telemedicine industry-wide. In 2015, 90% of consultations were via telephone. And you see that in our reporting as well. Primarily, our members use the telephone for their consults with our physicians. How telemedicine has become impactful is it has, for the first time, where we can leverage technology in the healthcare industry and make it cost-effective and convenient. For those two to converge has never happened in the healthcare industry, and that's why telemedicine has exploded over the last several years. Telemedicine is not a replacement for a PCP relationship. It is built on an urgent care model. for non-emergency acute care incidences. In 2006, the AMA did a study and discovered that up to over 60 to 70% of in-person office visits could be handled telephonically via telemedicine. These are common conditions like cold and flus, sinus infections, upper respiratory infections, tummy aches, allergies, rashes, things like that. Things that would typically take you to an urgent care or a retail clinic at a minute clinic or something like that. You can handle from the convenience of your own home, or if you're on vacation or work travel. Prescriptions are e-prescribed to the member's pharmacy of choice. The member tells us what pharmacy they would like the prescription sent to if our physician deems it necessary. A consultation does not guarantee a prescription. Our physicians are very cognizant of CDC guidelines with the over prescribing of antibiotics, etc. So our physicians prescribe about 68% of the time. A typical in-person office visit with a PCP or an urgent care center, they prescribe about 72% of the time. So our physicians prescribe a hair less than in an in-person office visit. Generic drugs are automatically recommended and prescribed unless brand names are required. Use of antibiotics are limited to appropriate durations. And we do not prescribe DEA-controlled substances, medication for psychiatric illness, or lifestyle drugs. All of our physicians are board certified, third-party credentials, and they're licensed in the state that the member is having the consultation in. So if you are traveling on business to North Carolina and you are in need of a consultation, you'll speak to a physician licensed in the state of North Carolina. We survey 25% of our members every year. This is our 2015 numbers. 92% of our patient issues were resolved at the time of service. In 8% of the cases, they're either truly an emergency, that typically handles about 2 to 3% of the time, and they're referred to an ER. It could simply be outside the scope of telemedicine, or a true referral is needed to a specialist. But 92% of the time, the one consultation handles the issue. We have a 97% member satisfaction rate. We've got over 1.5 million members. In 2016, we did over 80,000 consultations. Again, they're available 24/7, 365. Zero malpractice claims. We back our phone consultation with a 1-hour guaranteed response time, but our company average is a little under 15 minutes. So when a member requests a consult, whether they do it on our member portal or by calling our member services line, typically in under 15 minutes, the physician is reaching out to that patient to conduct the consultation. Successful utilization is related to changing behavior. So once we get someone to use the service, rather than instinctively getting in their car and driving to a PCP or an urgent care center, once we get them to pick the phone up and talk to one of our physicians, 98% of the time they use it again. So that change of behavior is important to a successful telemedicine program. And in a few minutes, I'll show you the efforts we go to communicate directly with our members to instigate that change of behavior. And then our clients are happy. Again, that speaks to the size of our company. We are large enough to handle all of our clients and our members' needs and desires, but yet small enough where we can customize a program. We can customize member awareness materials with co-branding logos. We can customize plan design. We can do a lot of things, making the plan fit what you need it to fit for your population, rather than us providing you a product that you have to fit into. So we are very flexible in that regard, and almost a 99% client retention rate. So map of services. As telemedicine has developed over the last several years, different states were a little slower than others. For instance, as of fall of 2017, Arkansas just came online for telemedicine. There were restrictions in Texas and California and Georgia, where I happen to live. But now, as you can see, all states but Idaho are fully functional with telemedicine. Idaho, the only caveat is that they require video consultations only with a prescription. So we get the question a lot if our program is more successful based on a variety of factors. Are you more successful in white collar or blue collar? Are you more successful in higher educated populations or middle educated populations, et cetera? The answer is no. We did a study internally of our clients, and we've got successful programs across all sectors of industry: manufacturing, trucking, organized labor, financial services, education system, municipalities, healthcare systems, and then, of course, a variety of small business owners across the country. We dove a little deeper and took a harder look at that, and these two companies have been with us since 2009, a lumber company and an insurance company. Tried to find two clients that had similar pictures as far as size of company, and two different sectors to take a look at, are they truly successful? And as you can see, with telemedicine, with 1-800-MD, both have experienced, and these are 2015 annualized claim savings numbers. So both have been very successful with year-to-date savings net claim savings of over $24,000 with the lumber company and almost $40,000 with the insurance company. And I'll talk to you a little bit about how we capture claim savings estimates when we get to our utilization reporting. So just one more slide that speaks to the explosion of telemedicine. JAMA did a study in the fall of 2015 and found that the average total visit time for an in-person medical visit, and these are for acute care, non-emergency issues. This is not for well visits or prenatal care or anything like that. This is for your average sinus infection going to the doctor to get a prescription. Average time was 123 minutes. That includes your travel time, wait time, face-to-face with the physician, etc. And what that means in hours is over 1 billion hours of time and $25 billion seeking medical care for acute care, non-emergency instances, which telemedicine is a perfect fix for. So 1-800-MD's competitive edge, again, to talk a bit about us and our strengths, our integration. We're vertically integrated in that we do not third-party vendor a call center. Our call center is in our corporate offices in Charlotte. The employees of 1-800-MD are our member service representatives. We have member services, client services, member awareness, our marketing teams, our IT team. Everything is vertically integrated within our corporate offices. So when we have a client come on board, that client gets a dedicated team member from each of those divisions so that you know who to contact with any question, concern. You have a new member to add, you've got a member that has a question about how to use it, you can pick up the phone and talk to somebody. We are a standalone product. We are not tied to a carrier. That means a variety of things for you. Flexible plan options, again, back to our flexibility. Our most popular plan is a $0 consult fee plan, where when a member has a consultation, it costs them nothing. It's $0 on their end. We are a PEPM model, per employee per month, and that includes dependents, up to 5 additional eligible dependents. It also means that our benefit can be offered to those that may not be on the health plan. If you have part-time employees or non-insured, uninsured employees, this can be offered to those employees as well. It also reduces your claim footprint. We do not report back to insurance or companies regarding claims. So a consultation with 1-800-MD does not equate to a claim on your end. Our plan is designed to engage clients and to really push member engagement. And we track all that with quarterly utilization reporting. Before I get to the member awareness pieces and the reporting, in each proposal, and some of you may have seen a 1-800-MD proposal before, we offer 2 claims analysis breakdowns. One is a break-even sheet, and one is an expected savings sheet. On the break-even sheet, what we try and show you is, based on your group size, how many employees you have, how many total members, including dependents, what we would expect to handle in incidences in order for you to cover your access fees and claim savings. On the expected savings sheet, we take that same information and treat you as if you're one of our average groups. Our average utilization in year 1 for a $0 consult fee plan is 17.5%. It's actually ticked up a little closer to 21%, but we still use 17.5% for year 1. Year 2, it bumps up to about 20%, and in year 3, closer to 25. Again, our numbers have ticked up in reality, but we still use these numbers for this evaluation. So we can show you based on your experience, what you can expect in claim savings in year 1, year 2, and year 3 if you act like one of our average groups. And again, those are our average numbers across our book of business. Integration is also quite simple. It is a 10-day implementation process. We have, again, a dedicated client service and member service teams that help walk you through that process. We've got a user-friendly member portal and client portal, so the members can access their health history, they can request consults, they can add their dependents. And our client portal, the group themselves can manage their eligibility, manage their invoices, take a look at their reporting on an on-demand case-by-case basis. Member awareness strategies, you've got a dedicated member awareness team. Again, we can customize with co-branding of logos, but we communicate monthly with our members, one time a month. And then we measure that. We measure the program's success with the utilization reporting. So at enrollment, a member will receive a welcome letter and ID card. We also have kind of the common open enrollment materials available to help support you during open enrollment with brochures, posters, refrigerator magnets, and postcards. We also do seasonal marketing during cold and flu and spring allergy seasons. We'll send postcards out. And then this is an example of some of our member awareness pieces. This was the back to school piece a couple of years ago. And then we have a generic why wait piece. And again, we communicate monthly with our members, one time a month, to just remind them of the service. Again, going back to that changing behavior, remind them about the service, prompt them to activate their account and fill out their health history, a variety of communication pieces. So our IT team, our director of IT, built our platform with our IT team so that our member portal and our client portal have the same look and feel, so both are very user-friendly. Members can access their personal health histories, add their dependents, request consults, etc. The client portal, again, you have the ability as the group to manage your eligibility. You can order new ID cards for them. You can print out marketing materials. You can request co-branding of materials. You can see your invoices. You can pay your invoices. And then, of course, your personal group contact information. And then our post-sale utilization reporting. Again, we provide this quarterly. It's a multi-page report. I've only got a few pages as images in the presentation for you. The first page is an overall snapshot of the whole plan. It shows you what you're paying in access fees, what your members are paying in consultation fees, month over month, how many consultations have happened. When a member requests a consult, whether they're doing it on our member portal or by calling our member services, they are asked, the very first thing they are asked is, where would you have sought treatment if you did not have 1-800-MD? An urgent care, emergency room, PCP, or retail clinic. We capture that information so that we can then show you on a consult by consult basis where that member would have sought treatment if they did not have 1-800-MD. And what that equates to then is in claim savings. So rather than 10 visits to the ER and 27 visits to an urgent care center, you had 37 telemedicine visits. And here's what that is, what that claims experience savings is. We then break that information down. We'll show you what your top prescriptions are, and this is by group. This is not our overall book of business, so this is specific to each group, what their top prescriptions were and what their top diagnoses rates were. We show you month over month where you're tracking in ROI, gross cost versus total savings, and again, there's multiple pages to this report, and that is provided quarterly. So the last thing that I'll just touch on, that Marcelo, we were down in the Phase-In offices a few weeks ago, Andy and I, and we're excited to present to them added enhancements to the 1-800-MD brand. It's something called Navigo Health. Navigo Health saves money on out-of-pocket medical and prescription drug costs. What it is a subscription-based program. It's a web and mobile app platform. It's designed for high-deductible health plans, underinsured populations, or uninsured populations, employer groups, associations, unions, things like that. Tools that help members navigate healthcare as a smarter consumer. We all know, because we've all experienced over the last few years, healthcare is a consumer product now. With high deductibles and out-of-pocket costs, a lot of us are paying a lot of out-of-pocket costs until that deductible is met, and sometimes none of us meet that deductible, depending on how high it is. What these tools are is these are ways for members to save money as they navigate their way through their healthcare. So the telemedicine product is the flagship product, of course, the 1-800-MD telemedicine. But then we offer 8 additional pieces. And groups do not, this is all customizable. Groups do not have to choose the entire package. They can choose 2, they can choose 4, they can choose 7. Telemedicine has to be a piece of it because that's the flagship product. And that's the most impactful from an ROI standpoint from an employer group. We also offer prescription savings, a medical pricing transparency tool. And these are all things that we've built ourselves. Health records. 2019, it's federal law that all health records will be electronic, so that one is not yet launched, of course, because we're waiting for compliance to come through for all of that. Medical bill negotiation, those are for claims that have already been paid, and you get your explanation of benefits and your invoice, and it's $4,000 and you're unable to pay that. We have the ability to first scrub the bill, make sure it's coded correctly. We can also negotiate on the member's behalf for a one-time payment, and then we have partner programs for financing to pay that bill so that people don't ruin their credit because of healthcare costs, unforeseen healthcare costs, or catastrophic healthcare costs. Over 60%, I think it's 66% of bankruptcies are due to healthcare costs. So we feel like that's an impactful tool. We've got eligibility lookup with an insurance verification program, over 1,500 insurance plans loaded. You could take a look at, where you stand with deductible and out of pocket, et cetera, what your copays are. Medical second opinion, which is a best of class second opinion service. These are for those 5% of cases that are catastrophic, whether it's a cancer diagnosis or a blood disease diagnosis. This is a consortium of educational hospitals, Harvard, Brigham and Women's, Mayo, that come together, take a look at the records, and offer 30% of the time they actually change the diagnosis. About 60% of the time they change the treatment plan. And this is not in competition with the existing provider and specialists or team. This is just in conjunction with, hey, we've taken a look at this with our panel of physicians that are world class, and these are our opinions on it. Behavioral health, telehealth behavioral is launching, which it offers therapy and psychiatry services in a telehealth format, meaning that you no longer have to go to your clinician's office. You have the ability to establish a professional relationship with one of our clinicians, they're either therapists or psychiatrists, and schedule your video consults for your behavioral health needs at your convenience. And then lastly, we have a healthcare liaison service where that person can walk a member through all of the benefits that they have, and again, helping them navigate healthcare and their specific healthcare needs as it relates to consumerism and lessening out-of-pocket responsibilities and alternatives for treatment, care, and prescriptions. So just to summarize, 1-800-MD, the strength of our integration, we feel like we are great partners for not only our agencies like Phase & Group, which are great partners for us, but also for our clients, helping them be successful because that's our focus. Dedicated teams for member awareness, client relations, member services, marketing and for co-branding needs, etc. Being a standalone telemedicine service, being independent of those carriers, gives you the opportunity to have the most impactful telemedicine benefit for your employees. Our simple implementation process, our member and client portals, our best-in-class utilization reporting, again, that's provided quarterly, and then the new enhancement with Navigo Health that gives you a lot of flexibility to provide a variety of benefits for your employees. So Marcelo, I'll hand it back over to you. I have to say thank you again to everyone for their time, and I also am very appreciative of the opportunity to talk a little bit about 1-800-MD and touch on Navigo Health a little.
Yeah, thank you so much, Carol. We did have a few questions come in. For anybody else, if you do have a question, now is the time to put it into the chat box. So Carol, one of the questions was, could the behavioral health through Navigo replace an EAP program? Carol? Why won't...
Marcelo, can you hear me now?
Can you hear me, Carol?
I can hear you.
Okay, I'm not quite sure what happened. I do apologize for that. Thank you so much for presenting. We did have a few questions come in.
Sure.
And if anybody else wants, now is the time to type your questions into the chat box. One of the questions that came in was, could the behavioral health through Navigo replace an EAP program?
Oh, that's a great question. So we consider that could be, yes. The short answer is yes. Telemedicine in general, behavioral health, telebehavioral health can be considered an EAP, but I'd be happy to talk directly off the call and kind of get further down the road with that, but absolutely.
Okay, perfect. We could definitely follow up with that individual more in detail. Another question, is there a minimum number of employees to use this?
Oh, that's a great question, and I appreciate you whoever asked that, and I apologize I didn't cover that. Because Phase & Group, because of the strength of their partnership with us, what great partners they have, we do not have a minimum number of employees for Phase & Group. They also have very aggressive negotiated pricing, so they're very, very competitive. But no, there's no minimum. We have groups with Phase that are as small as 2, and of course as large as several hundred to over 1,000.
All right, thank you. And is there a minimum age requirement to use the service?
Oh, another good question. Thank you. There is not a minimum age requirement. Now, it is ultimately up to our providers. If a parent is calling in for a young dependent for a child, and most likely the physician will prefer speaking to the adult, to the parent or guardian that's calling on their behalf, because the patient, if they're unable to, of course, communicate what their symptoms are and what their needs are, then we're going to rely on that parent or guardian. But no, there's no age requirements.
All right, thank you. And we had one more question come in here. What is the copay?
Oh, great question too. So we offer a variety of plans. Our most popular is $0. So when the member calls, there's no copay or consult fee attached to it. We can also plan for a $38 copay, 20, 10, or zero. But zero is our most popular. About 85% of our groups are all $0 consult fee.
All right, thank you. And how would someone go about getting a quote?
So I would, you can reach out directly to me or, of course, through Phazon. Phazon, I have a one-page kind of RFQ form. It gives me client name and all the information that I need to generate a proposal. And we like to turn those around within 24 hours. But they
All
can
right,
also reach out directly to me.
sounds good. That is all the questions we have for now. I just want to remind everyone that they will be receiving a follow. Oh, we have one more question. If there are no co-pays, who pays and what is the cost?
Okay, so this is provided by the employer. It's a per employee per month model. So typically for a $0 consult fee plan with Phazon's pricing would be anywhere between $3.48 to $2.98, dependent on group size, and that's per employee per month, and that is a $0 consult fee plan.
Thank you for clarifying that. So yeah, everyone will be receiving a follow-up email from us. That's going to include the slides you saw here today, along with the recording. And I'd like to just thank everybody for attending, and thank you, Carol, for doing such a great job presenting.
I appreciate it, Marcelo. I hope everyone has a great holiday weekend upcoming.
All right. Have a great day, everyone.